Hello everyone. Thank you for joining us. Today, my team member and I are going to present a survey report and an analysis we conducted. So, since we are dentists, we decided to go with a topic that is related to the oral hygiene. So, we chose to select a survey on dental hygiene habits of a wide range of population. So, first, we will have a gross overview on what is oral hygiene and how does it impact our overall health. The majority of people take oral health and oral hygiene in a very light way and they fail to take the proper amount of care they should take, which ultimately leads to dental problems. We have noticed that majority of people visit dentist only when they have a problem or they rarely visit them, whereas it is mandatory to visit a dental office at regular intervals. It is said if you protect your oral health with good oral hygiene practices, that is, regularly brushing and flossing, the odds are all in your favor that you can keep your teeth for a lifetime. So, now we'll look on the importance of oral hygiene and its correlation to overall health. The connection between the oral health and overall health is often overlooked, but it's important to note that the two are closely intertwined. And the mouth being the first point of entry for food and oxygen, it plays a vital role in maintaining the body's overall well-being. So as you can see, these are some of the disorders which can be caused due to a very poor oral health. So now we look on the data collection and analysis process. So the data collection and analysis process involves several key steps to ensure that accurate and meaningful insights are derived from the collected data. So as the world has advanced from pen and paper to phone and computers, we decided to implement it in our study as well. So we decided to collect the data electronically, which would not even be the easiest but also the most convenient ways to reach out to people from all over the world. So we majorly wanted to rule out the oral hygiene habits and the awareness about the importance of oral hygiene. So we recorded the daily and general oral hygiene habits of the population. So as you can see, there are four ways. So it is data collection, data display, conclusions, that is drawing and verifying, and the data condensation. So everything is interrelated to each other, and this is the data collection process. So first we have the planning and design, the preparation, the data collection, the data management, the data analysis, data reporting, and finally the conclusion that would be drawn from all the studies and the analysis we would be doing. So this is a sample of some of our questionnaires which we included, like frequency of brushing, toothbrushing techniques, toothbrush type, etc. And we have also attached a Google form link so as to access the Google form so that the questionnaires would be there inside the form. So in this slide we have depicted the importance of flossing. So on the left side, as you can see, why is flossing important and what are the benefits of it. So while connecting the data, we notice that most of the people are unaware about the importance of dental flossing, whereas flossing and brushing your teeth regularly are both important for your dental hygiene. So for maximum benefit, the dentist recommend to floss before you brushing rather than after you brush your teeth. So we have tried to inculcate a bubble chart to show our data. So a bubble chart is nothing but it is a type of data visualization that displays three-dimensional data using bubbles of different sizes and colors on a two-dimension graph. So this is how we have tried to show it. So we have included the brushing, the flossing things, like how many times everyone flosses, and we have also tried to inculcate the brushing minutes of every individual. So as you can see, our study clearly shows that the number of people who floss regularly are very less as compared to the people who don't floss at all or who floss very rarely. So this is a clear sign that the significance of flossing in this population is still unnoticed.
Our survey, we noticed that the maximum amount of people only sees the dentist when they have a problem, while it is required to have a dental visit at least twice a year. I heard somewhere it is important to have more dental checkups in order to have less dental treatments. There are many factors that contribute to good oral health, but regular visits to dentists are an essential part of keeping your teeth healthy and preventing problems. We have shown our data of frequency of dental visits with the help of a Pareto chart. The Pareto principle, also known as the 80-20 rule, states that roughly 80% of the effects comes from 20% of the causes. In the context of Pareto chart, this principle means that a significant portion of the total frequency or magnitude is contributed by a small number of factors. Right toothbrush type and brushing for the recommended duration are an essential component of a proper oral hygiene routine. Together, they contribute to effective plaque removal, access to hard-reach areas, comfort during brushing, and overall oral health maintenance. Its importance for individuals to choose a toothbrush that suits their needs and to brush their teeth for recommended duration to ensure optimal oral hygiene and prevent dental problems. As you can see, we have used a clustered column for our data. Each cluster column represents the population's preference for a specific bristle type that includes medium, soft, and hard bristles, with the height of the column indicating the percentage or number of individuals who prefer that type of toothbrush. This in future can help us to detect, assess, or predict the teeth's wear and tear. In our data, we have seen maximum people using a soft bristle, which is a good sign because this is individually recommended by a dentist to avoid extra wear and tear of the enamel, which is the outermost layer of the tooth. We wanted to see the number of people using different types of toothbrush bristles. Clustered column charts are commonly used to compare values across multiple categories or subgroups. They are particularly effective for visualizing changes or differences in data over time or across different groups. By grouping related data together in clusters, this type of chart allows for easy comparison and analysis of trends, patterns, and relationship within the data set. This is we will be using a dental index which will be helping us to draw our conclusion. The Simplified Oral Hygiene Index, also known as OHIS, is a modification of Original Hygiene Index OHI developed by Green and Vermillion in 1960. The OHIS is designed to provide a quick and straightforward assessment of an individual's oral hygiene status by focusing on key indicators of oral cleanliness. It is commonly used in clinical practice and research settings to evaluate oral hygiene and monitor changes over time. The OHIS provides a simple and objective method for assessing oral hygiene status, allowing dental professionals to quickly identify areas for improvement and tailor oral hygiene instructions and interventions accordingly. It is an effective tool for evaluating oral hygiene in both clinical and research settings. This is also widely used in community camps when you have to assess a big population like a community school or society. Interpret and analyze according to the index. On the extreme left, you can see the box which includes the interpretation of the OHI index, which dictates the oral health cavity based on the data and findings gathered. On the extreme right, you can see a oral hygiene measure meter which dictates the oral health of the population whose survey was done. According to the ratings showing in the middle, our oral hygiene measure meter is somewhere between average and good. The data collected was from a highly literate group where we expected the oral hygiene measure meter to be somewhere between good and excellent. It wouldn't be wrong to say that the world hasn't yet realized the importance of flossing, wherein the mouth cleaning is incomplete without flossing. The slide, extreme right of the chart, only 20% of the population brushes regularly, that is twice a day, and flosses at regular intervals. So in conclusion, the finding of this study underscores a concerning trend. A significant portion of the population does not floss regularly. Through surveys, interviews, and data analysis, it has become evident that there is a widespread lack of awareness and understanding regarding the importance of dental flossing among various demographic groups. The implications of these findings are significant for public health and dental care initiatives. Poor oral hygiene, including inadequate flossing habits, is associated with an increased risk of dental caries, periodontal disease, and an oral health problem. Furthermore, oral health is interconnected with overall health, which research indicates potential link between the oral disease and systemic conditions such as cardiovascular disease and diabetes. By raising awareness, providing education, and implementing targeted interventions, healthcare professionals and policymakers can improve can work towards improving oral health outcomes and reducing the prevalence of preventable oral disease. Collaborative efforts across multiple sectors are needed to effect meaningful change and empower individuals to prioritize oral health through regular flossing and other preventive measures. A majority of individuals in primarily seeks dental care only when they experience dental problems rather than engaging in preventive care through regular dental visits. It has become evident that there is a widespread lack of understanding or adherence to the importance of routine dental checkups and preventive care among various demographic groups. The implications of these findings are significant for both individual oral health and healthcare systems at large. Delayed dental visits until problems arise can lead to oral health issues, increased cost treatments, and reduced quality of life. Moreover, preventive dental care plays a crucial role in identifying and addressing potential oral health issues before they progress into more serious conditions. Efforts to address this issue should focus on raising awareness about the importance of preventive dental care and encouraging individuals to prioritize regular dental visits as part of their overall health maintenance. That we have used for our study and our data analysis project. For watching us